Welcome to a new era of treatment of mental illness and drug addiction in Indiana.
Another big developing story, Governor Pence unveiling plans for a new hospital to treat mental and health addiction.
It's a shift in philosophy for the state. We have live team coverage tonight. Katie Hines is at the site of the new hospital. Jack Reinhart talked with emergency responders who deal with mental health issues on a daily basis. We begin with Katie live at Community East Hospital.
The governor says the $120 million facility will serve as the hub of the mental health services here in the state of Indiana. He says it will also be at the center of a new model for care for some of the state's most vulnerable patients. Numbers from the state show the availability of inpatient psychiatric beds has dwindled to nearly 13% of what it was in the 1950s. Governor Pence says that has led in part to this staggering number. Half of all of the inmates in Indiana's jails or prisons suffer from a primary mental illness or a drug addiction.
Patients with chronic psychiatric disease and relapsing chemical dependency and addiction have often become homeless, moved to nursing homes, been cared for in emergency rooms and general hospitals, and most troubling and most disturbingly, many have simply been placed into Indiana's jails and prisons.
Stephen McCaffrey is the president of the nonprofit Mental Health America. He says the need for services is overwhelming and one the state hasn't been able to meet.
We have a bad tendency to provide the services that we have, which are inadequate, as opposed to the services that people actually need.
The governor says the focus will be making a precise diagnosis for every patient to treat brain-based disorders such as traumatic brain injuries. The Neurodiagnostic Institute will have the capacity to treat 1,500 patients a year. It will include 159 beds, 30 for adolescents and 12 for children. The facility will eventually replace LaRue Carter Hospital, which will be phased out of operation, and it will serve as a connector between the remaining 5 state-operated psychiatric hospitals.
We cannot any longer allow Hoosiers afflicted with mental health and addiction disorders to fall through the cracks or to fall into wrong choices.
The state will issue a 20-year bond as part of a 2-stage financing process. That's pending the approval of the state budget committee scheduled to meet tomorrow. Community East will manage and provide services at the state facility, and construction expected to start next April. Then they hope to open the hospital here in late 2018. Reporting live on the east side, Katie Hines, RTV6.